Next step in the process is to prepare your medications for injection. The most important medication we use is Lutalice. Lutalice is a brand name for prostaglandin F2 alpha. There are other brands of prostaglandin F2 alpha that are actually congeners, and we have found them much less effective. So we definitely favor Lutalice for the purpose of inducing egg laying in turtles. The other drug that we frequently use is Sedivet. Sedivet is an alpha-2 agonist. Sedivet is used as a sedative in veterinary medicine primarily for horses. Because it's used for horses, you have to dilute it substantially when injecting turtles. The tools we use for the dilution process are a 5 cc syringe for the normal saline, and we favor tuberculin 1 cc syringes for the injection process. We label them L for Lutalice and S for Sedivet. This is to avoid confusion later on, and it's quite easy to get confused. For needles, we prefer to use a 22 gauge, 1.5 inch needle for the purposes of drawing up the drugs. And for the purpose of injection, we prefer a 25 gauge, 1 each needle. The formula we use for the dilution is shown here on this piece of paper. First, I'd like to point out that we use Lutalice undiluted at a dose of 1.5 milligrams per kilogram. The Sedivet, which comes as a 1% solution or 10 milligrams per cc, is diluted by preparing 1 cc of Sedivet and 4 cc's of saline to produce a final concentration of 2 milligrams per cc. And the dose of Sedivet is 0.5 milligrams per kilogram. Now I'll show you how we do the dilution. The first thing we do is draw up 4 cc's of normal saline. We then inject that into a separate container. Then we draw up 1 cc of Sedivet. And then that is injected into the same container to produce a final concentration of 2 milligrams per cc. So now you have your two agents ready. You have your Lutalice and your Sedivet, and you can move on to the next step of actually injecting the turtle.